Thank you, Mr. Chair, and I want to thank all our witnesses for being here today and sharing on this important issue. I'm going to start out to Dr. Day. It's spectacular to have another Albertan here in Ottawa. One of the things that I have found is truly revolutionary in the world of addiction treatment is what Alberta's been doing with the virtual opioid dependency program. And I was wondering if you can go into a little bit more detail exactly how it works.
Yes, happy to do that. So the way that it works today in Alberta is, for example, if a person were at home and they were concerned about their opioid use, or maybe they'd ran out of their supply of drugs and they're in withdrawal, they can just call directly to a toll-free number, 1-844-383-7688, and they will get immediately connected with an allied health team member who will start to explore their situation. In Alberta, we have the benefit of a single medical health record, so we're able to see all of that person's health records from their hospital visits, previous overdoses, things like that. And then that person, once they complete that assessment with our allied health team, is almost immediately, it depends on how many people are phoning at one given time, but usually in not less than 15 minutes are connected with an addiction specialist who can then walk through what their treatment options are and then prescribe a pathway forward for them to start evidence-based treatment medications. The prescription is sent to the pharmacy closest to where they live and or work as their preferences, and then that person can start right that day with treatment. And our team, of course, will follow up with that person, later that day or the next morning, see how they're doing, and we adjust the care from there.
So then what would happen if that person was, say, in a rural community like Janvier and about an hour and a half away from the closest pharmacy? What would happen to someone like that?
Yeah, so that is a challenge. We have many communities in Alberta that are rural remote and that have more challenging access to a pharmacy. So, for example, we're in your riding in a fly-in community. We've been working with the local health teams in that Indigenous community in order to have a supply of medication stored there on site securely so that we can actually send the prescription to that nursing station and the medications can be provided to that person as needed. Further, we're also working in Alberta to address this problem by enabling our paramedic teams to be able to carry evidence-based treatment medications as part of their kit so that we'd be able to actually connect with our integrated health teams in the EMS world to bring the treatment right to that person.
I think that's truly revolutionary, and I know that required an exemption from Health Canada to even make that possible. Are there any other stopgaps you might have when it comes to Health Canada being in the way of you guys being able to expand this amazing service?
Well, to be honest, we started working with paramedics about 4 years ago. Unfortunately, we discovered that our work was illegal because at that time, paramedics were not allowed to carry Suboxone or Sublocade in their kits. We weren't aware of that, and our paramedics weren't aware of that either. And actually, we were presenting some data on how well it was going when it was brought to our attention that we actually couldn't do what we were doing. Unfortunately, it's taken several years to get the change that's just recently, just in the last couple of months, allowed us to now move forward. And we're looking forward to being able to announce and implement in just a few weeks from now a province-wide program.
Thank you for explaining that. And I think that just highlights how challenging the bureaucratic mess of Health Canada can be. You did something that is truly revolutionary, getting Suboxone, Sublocade, absolutely evidence-based treatment modalities into communities using innovative solutions, and yet the bureaucracy says that it can't happen, and it took years to get that. So I guess my next question is, can you walk us through what the OPD would look like in Alberta Corrections?
Yeah, so in Alberta Corrections, we of course continue people who are on evidence-based treatment medications after they're arrested. We also will start people on treatment medications. Unfortunately, Canada's largest correctional facility is in Edmonton, the Edmonton Remand Centre, and its average length of stay is about 2 weeks. And what we were finding is that there were a large number of people coming in who were not able to start treatment right away, and the wait time to get treatment was as long as 4 to 5 months. So you can imagine that many people were coming in, were not able to start treatment, and then were released before they had access to treatment, which is a problem. So today, the way that it works is that a person goes in, they're immediately screened for opioid use disorder. They're able to provide a toxicology screen to support that. We do a video recording and connect that with our virtual opioid dependency team, and that person is now able to be assessed and initiated on treatment. I think the average is now 0.9 days from arrival, and we've completely resolved the wait list problem there by using technology.
Thank you, Ms. Goodrich. Next